Do you frequently feel like your heart is heavy or your belly feels full, even when you haven't eaten much? What if your bones hurt often or you get bruises from just a small bump? These might seem like everyday issues, but for some people, they're signs of something deeper, like Gaucher disease. Imagine your body as a recycling center. Every cell breaks down old parts and recycles them. In Gaucher disease, one tiny worker in that center is missing, so trash, a kind of fat, starts to pile up, especially in the liver, spleen, and bones. This leads to real problems that can affect how someone feels and lives every day. So what causes this missing worker? Gaucher disease is caused by a broken gene. Yes, a tiny error in your DNA that you inherit from your parents. Let's think of it like a recipe book. If one instruction is smudged, the kitchen can't make the right dish. Here, the body can't make an enzyme called glucose riboside. Without it, a fatty substance called glucose riboside builds up in cells, turning them into Gaucher cells, bloated, unhealthy cells that don't work right. You get the disease only if you inherit the faulty gene from both parents. If only one parent passes it, you're a carrier. You won't get sick but could pass it on. Now, how would you know if someone has Gaucher disease? Symptoms can vary. Some people feel tired all the time because they don't have enough healthy red blood cells, anemia. Others notice their belly looks big because the liver or spleen is swollen. Some kids or adults break bones easily or complain of bone pain, like having constant toothaches, but in the legs or hips. Easy bruising or bleeding from the nose might happen too. Here's a test. Press your hand gently on the upper left side of your belly. Does it feel tender or swollen? That might be a clue. But remember, these signs can look like other issues, so we need tests to be sure. First, they check your blood for low red blood cells, platelets, or high liver enzymes. Then, a special blood test measures how well the glucose riboside enzyme is working. Low activity means Gaucher is likely. They might also take a DNA test to find the gene problem. Once diagnosed, treatment can help. For many, enzyme replacement therapy, or ERT, works like delivering a new worker to the recycling plant. It gives the missing enzyme through IV every 2 weeks. Another option, substrate reduction therapy, or SRT, reduces the amount of fat made, so less trash builds up. These treatments don't cure the disease, but they help people live better, stronger lives. Can we prevent Gaucher disease? Well, we can't change our genes yet, but we can be smart. If your family has a history of Gaucher, or you're from groups like Ashkenazi Jewish people who have higher risk, you might consider genetic testing before having kids. Imagine taking a quiz that tells you if you carry the broken gene. If both partners are carriers, there's a 1 in 4 chance their child will have the disease. With that knowledge, families can choose options like IVF with genetic screening or prepare early for treatment. So while we can't prevent it entirely, we can plan and act wisely. The future looks hopeful. Scientists are working hard on new treatments. One cool area is gene therapy. Imagine fixing the broken gene in your body's cells so your body makes the enzyme on its own. Early trials show promise, like giving patients a one-time treatment that could last years. Another advance is better SRT pills that are easier to take than IVs. Also, newborn screening for Gaucher is being tested in some places, catching it early before symptoms start. Imagine a world where a simple heel prick at birth could prevent years of pain. That's the kind of future researchers are building step by step.